something new. I said free your mind, she's a whole mood. I'm a pure vibe, killer with the flow. She killin' with the wine, make back shot, driller, pull the trigger from behind. Whoa, simmer, yeah, we got time. Don't have a beamer, but I'll take you on a ride.
Hello everyone, welcome to another edition of Microbiotics About Talk. Good morning to you all. Hope you've been fine. I've been fine as well. My name is Tayo Fasun. I'm the Chief Research and Communication Officer of Microbiotics. And like I told you the last time, I'm working on national projects which involve preparation, or should I call it preparedness, and response to I'll say COVID-19, but with also other diseases. So the project is actually to prepare us, to prepare every state, to prepare the country in order to respond better in case of any epidemic or emergency. So the last time we spoke about the different pillars that are included in any preparedness and response project, and this morning we'll be focusing on a very important part of these pillars, perhaps even the most important in some ways, and that particular pillar is the coordination pillar. The coordination pillar. The coordination pillar is very, very, very important, and of course, without coordinating any of the plans that we have, we'll just be having an uncoordinated activity, and most of this work we ended up not actually yielding the results that we wanted to yield. So, for any preparedness and response plan or project, coordination is part of the component. And part of this coordination, lesson about coordination is actually being learned a lot from a lot of projects around us. Let's say, for example, the polio eradication project, and since WHO is one of the strategic partners providing support for most preparedness and response plan, their coordination techniques and methodologies that were used in polio eradication, which involves also things like community contact tracing, risk communication, and every other instituted actions, will also be incorporated into any preparedness and response plan, especially COVID-19 response. A similar method was employed at the outbreak of COVID-19. So, and of course, coordination is needed for every other pillars that are under any preparedness and response plan. We've mentioned the pillars the last about talk that we had, and some of these pillars include the surveillance pillar, laboratory pillars, IPC, that's infection prevention and control. We have a case management pillar, we have a risk communication pillar, we have logistic pillar, and we have a research pillar. In some instances, there is also a point of entry pillar, POE, which are very important, especially in places that are borders. Borders like probably between countries. So, and let's bring it home a little bit. In Nigeria, of course, if there's going to be any preparedness and a response plan against any infectious disease, the Nigerian Center for Disease Control and Prevention, of course, NCDC, we provide leadership and coordination for public health response generally. And the State Ministry of Health, all State Ministry of Health and other relevant state agency of governments are responsible for the actual response. So why the NCDC provide coordination, the State Ministry of Health will be the one in charge of the actual response. And of course, even at the state level, there's still coordination. So the coordination is multisectorial in many instances. So, and of course, over the years, there has been lesson learned from different study when emergency response preparedness is to be instituted in Africa, especially West and Central Africa, based on past experiences. And one key lessons that I was learning is that most of the time, lack of coordination for the multiple sectors involved in the preparedness and response plan, and which also leads to lack of transparency, usually undermines the country response effort. And most of the time, this leads to duplication of resources. So most of the sectors involved in public health preparedness and response need to be coordinated well, so that what a particular sector is doing, the other sectors will not duplicate that effort, leading to waste of resources. And we realize that most of the time is because of this lack of coordination that we usually lead to lack of transparency. Because if everybody is open with what what they are bringing to the table, then coordination will be well done, and then the response effort will be positive. So, most of the emergency operations for preparedness and response planning are usually conducted nationally, and but the focus are usually on the states, and most of these plans usually support enhancement of institutional and operational capacity for disease detection. And this is done through provision of technical expertise and supporting coordination, detection, case management. All this must be consistent with WHO guidelines in strategic response plan. So, most PRPs, preparedness and response plan, involves support for coordination, monitoring, operational support, and logistic and project management. And coordination will usually involve provision of operational support to the national EOC, that's Emergency Operations Center, and as well as the state EOC. So we also have incident management system coordination structure and routine monitoring and the likes. So, and like I said, the coordination will involve relevant federal and state level institutions in planning and implementation and monitoring of preparedness and response. So, and it cuts across, of course, like I said, there are so many players, so many partners that are involved. We have, apart from the Federal Ministry of Health, let's say in Nigeria, and then we have WHO, we have UNICEF, we have NCDC, and then we have other partners who have to come together to overcome logistical constraint in provision of timely technical expertise and supplies, equipment, and systems. So, and for most projects involving preparedness and response, we have the project coordinating units, which is usually headed by the project coordinator. And this project coordinator, coordinating units will be responsible for coordination and management of project funds, and the carrying out of procurement, monitoring and evaluation, and reporting functions, which include transfer of project funds, monitoring of use of credit proceed by state and federal implementing entity. So, and as the activities under each of these pillars, which are to be funded, are usually derived from individual states approved response plan, which is usually prepared by the state EOC. So the plan are actually bring the response and preparedness plan are usually from the state emergency operations center, and then they are being transferred to the national body and request for implementation of this for approval. Once they are transferred to the national body, especially to NCDC in Nigeria, these activities will require approval, and once the once the activities are approved, then requests will be made for implementation, and then they will be carried out. So that's majorly what coordination is about in preparedness and response plan. And so just round it up, it has been noted that if coordination is well done, sustainability will be enhanced, because once all the activities are well coordinated, the efforts, the results will be more sustained even beyond the duration of the project, and through coordination with existing operations financed by the relevant donors. So if coordination is well done, the results, the efforts that's the positive effort that are being put into any preparedness and response plan will extend beyond the lifespan of the project. So on this note, I'll be calling it. I'll be stopping at this point. I know that you are going to have a nice day ahead of you. The next about talk, we'll be talking more of other pillars. We'll try and delve into it, just like we just delve into the coordination pillar this morning. So make sure that you have a nice day ahead of you, and like I always say, make sure that you stay healthy and then you stay very safe. Bye bye.
Always been a leader of the pack, young company. Oh my God, to lead from the back. Feel like say you new to the facts, running mad. I can tell you're not used to the cash. My OGs move to the back, sit back, chill with the trees and relax.
I said, wait till you walk on my place. I just can't you straight. Bring your body, but I tell nobody.